I see patients almost every day, and yesterday I was in practice. A patient came to see me, new patient. The patient brought me their records. This is what they handed me in my 20-minute visit. This is an example of the paper system that we currently have. Imagine if I were to have all of this information that the patient provided me in an electronic format from all their different health systems and providers. That's the thrill of the BEACON project.
I think that EMRs are really going to grow in popularity because the ease of use is going to be there, and because people are going to really see how well they integrate the rest of care. They bring the pictures in from the MRI. They send the information out to the physician office. They take the medical records from 4 different institutions and bring them into one view. That's really when acceptance is going to come, when it's no longer about my medical record, but it's about the patient's medical record.
Lincoln Hospital was selected as one of the partners for BEACON because of the geographic proximity that we have to Spokane. In addition, BEACON is a regional program that looks to serve a large population beyond just a metropolitan community. This was a logical connection for us to move towards a regional system of care for diabetes. Type 2 diabetes is a complex disease. It affects different elements of the body, and in order to be able to address those various components of the disease effectively, we need specialists that can assist us. Cardiologists, for example, nephrologists. All of those people help us provide the best care for our patients. So it's provided us the ability to be able to keep our primary care physician involved in the overall care, and that provides better care and more coordinated care, and the patient has a better chance for a good outcome that way. Being a part of BEACON brings support to our local community in a way that goes beyond the resources that we have locally. Having the ability to connect with specialists requires that we have systems in place and relationships for those specialty services. By being part of BEACON, we're able to use the platform of health information technology as well as care coordination tools that allow us to connect with those specialties for the services that our diabetic patients need. They're going to receive the best care that the region can provide. And with this connection that we have with Spokane, we have the ability to bring Spokane to Davenport and be able to provide that level of care locally. BEACON is extremely important to us because it brings us best practice. It brings us connectivity for our patients with the specialty community that is so important in assuring that the care that our diabetic patients receive is the best they can get. And so being part of BEACON gives us that opportunity for that connection and gives our patients the best opportunity for a good outcome.
Most recently, we've been working on the BEACON grant together as a community. We discovered that the importance of really getting early notification out to community members when one of their clients have been hospitalized. Our long-term vision is to have a ADT feed that goes out from the local providers to each of the medical providers, and then at the point of hospitalization, they would match the client who's being hospitalized to that ADT feed. The case manager then will be able to become involved at the point of admit, working on the discharge plan with the hospital, bringing the community focus to the medical provider and working together on a client-centric plan of care. But more often than not, we're not finding out till weeks or even sometimes even months after discharge that one of our clients has been hospitalized. And at that point, the ability to impact that plan of care and to connect them with community resources, we've missed that initial work on there, and sometimes that can be detrimental to the long-term health impact and increase overall cost for those clients.
BEACON experience is an extension of our focus on care transitions and care coordination. We've been attempting for several years, and now with BEACON have increased our focus on trying to make the collection and delivery of data easier, simpler, faster, and more effective, so that clinicians have better access to the data they need rather than just stacks of results or paper. What we're trying to do is to create information out of data. And Beacon has helped us focus in that effort. We've more than doubled the number of hospital data feeds that we're delivering. We've more than doubled the number of clinical practices who are handling that information into their electronic medical record systems electronically. And we have begun the deployment of population health management tools to help convert data into usable information at the point of care. The whole idea behind it is to improve not only the physician experience, but also the patient experience. Simply improving the timeliness of the data flows, converting it into usable information, improves not only the clinical experience as it relates to outcomes, but just the angst that we have embedded in the healthcare system. And anytime we improve both the patient experience in that regard as well as the physician's experience in improving their, I'm going to call it the digital experience, is a win for all. And I think that's what Beacon has helped everyone in this collaboration do.
I would say being part of Beacon has been one of the best parts, because it's not just checking boxes, it's not just, oh, we're getting meaningful use stage 1. It's actually, well, we're targeting a disease process, we're targeting an outcome of improving our blood pressures in our patients that gives us sort of an eye on the prize beyond just meaningful use stage 1. Would take regular meetings where we problem solve, where we have a team of experts bring ideas up, decide on things to implement, and then weekly training sessions at the clinics. So our structure for deployment has really been augmented by meaningful use, electronic record implementation, and then the Diabetes Improvement Project.
The Health InfoNet, it's really beneficial to us when we have patients who are going to another facility like St. Joe's. We don't always get those records on a timely fashion, so if I know that one of my patients has been there, we can see what they've been started on for new medications, what they've had for tests and procedures, so that our provider knows that, and they're not getting double labs or double tests that they don't need. It's saving them money in the long run, and it's making sure that their primary care provider is up to date on the most recent events in their life.
When I woke up from surgery, I was surrounded by nurses, my husband, of course, and my surgeon, and I was told that they would be back in just a few hours to get me up. The very next day we had a class, and we met a lot of the people who were in our informational seminar, and we immediately started therapy. I was bending my leg, I was moving back and forth, I was being taught how to walk. When I did get home, I received a phone call, and it was a nurse by the name of Kathy who said, I am going to follow you now and help you along the way. And I'll tell you right off, I felt comfortable, I felt cared for, I felt that there was going to be someone to follow me, to help me, to put me at ease, and to walk me through what was happening to me. Right away she asked me about my meds. And I was a little confused about my meds, because I know what I take on a daily basis, but then I had been on Coumadin therapy, and I wasn't quite sure about what's Coumadin all about and why. And yes, I know that was all explained to me in the hospital, but when you leave the hospital, you're confused, you've got a lot ahead of you, and especially when you've had a joint replacement, all you're worried about is, how am I going to move? So I felt that what a wonderful relief knowing that someone was going to help me through, especially on the medication aspect of it.
I'm Lindsay Davis, a public health nurse with Olmsted County Public Health Services, and my role is to provide case management to elderly and disabled individuals in the community. An elderly female dementia client who resides out at Sunrise Cottages Assisted Living in Rochester. She was hospitalized after a fall which caused a fractured hip and needed hip surgery. The social worker from the hospital contacted me as her case manager and involved me in her discharge planning from the start. We were able to get her into a dementia-specific nursing home unit where she could receive her therapies, but would also be able to have the cares necessary for her dementia. Had I not been involved, the hospital would have discharged her to a regular nursing home unit, and most likely she would have become delirious, and with them not being able to handle those types of behaviors, she would have ended up back in the hospital again. I do feel that my role made a difference in her discharge, and I'm hoping for a great outcome for her.
The system works because it treats each patient as an individual. The system works because it allows them to meet with one care manager. They're not telling their life story over and over every time they meet with me. I know them. I see them consistently. I talk to them consistently, like I do all patients. And that creates trust for them. It allows me to get to know them, their little idiosyncrasies, what's important to them, what they value, their lifestyle, their activity level, everything. And that allows me to make changes that are very small, that work for them. This is not a cookie cutter outfit, and the grant allows that. It allows you the opportunity to work with patients face to face. Wonderful. But I'll tell you, at the end of the day, it's amazing. Every single day. I talk to a patient that has lost weight, or their blood sugars are better, or their labs are a little bit better, and you know, the bottom line is those are, yes, all measurable items that prove, you know, that the care management approach is working, but really truly that person's feeling better. You know, it's effective, it's working, it's working. The Savoys, I'm so proud of them, all the work that they've done, it's working. I have patients that used to go into the emergency department every other week. They're not anymore. It's working. I have patients that are losing weight and their labs are better than ever. It's working. I have patients that did not engage with a provider or any educational programs in the community before. They're seeing me once a month or every 2 weeks without fail. It's working.
Well, Spokane is a city in the middle of a very large geographical area that is very rural. But yet there is a lot of small towns with people that have diabetes that need that kind of specialized care, and they have difficulty accessing it because those providers are not located in their small towns. The Beacon can help by providing some of that education and some of that care via telehealth, and talk in real time with an educator or provider that's located in Spokane, and having the technology piece of the Beacon so that different doctor's offices, different specialists can access a patient's medical record. That gives them instant information. When they are working with a patient face-to-face, they can find out what a report was from another office. You know, what was the information from that particular evaluation, and that will help improve the care that they're able to provide at that time because they have up-to-date instant information.
My first contact with Southeast Community Beacon was through my Dr. Stephen Hadesman. When I went to visit with him first time, he told me that my diabetes was out of control and he had a program that could help me get it under control.
The PHN program, or Patient Health Navigator program, is a program based on community health workers. These are people who aren't health educators, they're not nurses, they're peers of the patients who really work with the patients to help them improve their self-care. They help them identify what barriers they have to care, whether that's transportation or remembering their medications, and then they help the patient overcome those barriers so they're able to meet their care goals better.
Helping people like Glenda, the satisfaction that I get from this, I can't even describe it.
It's helped me to develop habits of watching my carbs and my calories, taking my steps, the fluid intake, taking my meds right. And so these are habits that help me live and not something I'm trying to get away from. I'm staying in these habits, good habits, because of the Beacon program.
It has lessened the burden on me of trying to find some way in order for my patients to be able to treat their disease.
Thank you for helping me live. Thank you for giving me the tools, the education. Thank you for empowering me to make better decisions. Please don't let this program go away, and I pray that it reaches more people.
IC3 Beacon has aggressive goals to move clinical measures related to adults with diabetes. While much of the work is focused on quality improvement in the clinic setting, we know that the 15-minute clinic encounter is too brief to really change patient outcomes. We recognize that there is a need for strategies to engage patients in healthcare decision-making and behavior change outside of the clinic. The IC3 Beacon is innovating with a number of tools to help patients succeed beyond the physician office setting.
Everyone now has a cell phone. It's just exploded. 8 in 10 adults in the U.S. are now using a cell phone. And they're not just phones anymore, they're computers, and they're with a person at all times. And so we have this huge opportunity to look at how to use that personal computer that's in your purse, in your pocket, to better manage patients outside of the clinic. The primary program that we have in the mobile health area for consumer engagement is a program called Care for Life. It's two-way, so the patient can interact with the system and the system will adapt for that person. It's much more personal that way. And I like to think of it as sort of a pocket care manager. So one of the challenges that we're trying to address with the patient engagement work for Beacon is how to change self-management, patient self-management, and self-care behaviors from something that's a chore and kind of a drag to something that's maybe even fun. There's a way that we could work in diabetes, education, and tracking into a game that could actually be fun and get people excited about competition. This next year we'll be looking at finding beta testers for this game, which is a martial arts theme, but it's really built around diabetes self-management, things like blood glucose tracking, exercise, diet, carb counting. And the way it works is you're trying to earn a colored belt. So you start out as a white or yellow belt and you're working up to black belt, and you unlock these different modules as you master certain types of activities.
People with severe mental illness like schizophrenia or bipolar disorder die 25 years earlier than the general population. And the reason for that is that they don't get the health care they need. They don't die from their mental illness. They die from diseases like cardiovascular disease or complications for diabetes. The incidence of mental illness, depression being the most common one in this population, is enormous, right? So about 1 in every 4 people who have a cardiac illness become clinically depressed. And it just didn't make sense anymore to have those two systems separate. Their psychiatric disorder was such that when things got bad, they would try to kill themselves, overdose. And one of the ways they were doing that was with the prescribed medications they had for their healthcare condition. So we were able to get a way that they could actually keep that medication locked up and only, it's like a home lock dispenser that would only dispense how much they needed. Having a care coordinator that could really dig in and spend a lot of time lining up all the different things in that person's life, we think that it may have saved that person's life. Oh, that's not my problem, that's your mental health provider's problem, why don't you go call them? As long as we're still giving people that answer, the system's not going to work for people. And I think we're doing a little less of that now.
Another important area where good information flow can improve care is emergency medical care, specifically end-of-life care.
A POST is a physician's order for life-sustaining treatment, and it's a legal physician order that's designed to be portable from environment to environment.
So once we complete the POST form, we give the original to the patient to either take home or go to a nursing facility with. We try to send the original with the patient. We make copies for the family if they want one. We make a copy for their electronic medical record here at our hospital and scan that in.
So for example, if you came in with a cardiac arrest and weren't able to speak for yourself, but we came to the information, your family was there or whatever, that you have an advanced directive and an e-pulse, I could simply log into a database, and in 30 seconds I could print up or pull up a copy of your wishes and make sure that they're honored at the time of need. When EMS arrives, if the paper's not found, bottom line, it's difficult for the EMS providers and myself to make a decision about what treatments to provide this patient who's no longer able to speak for themselves in this emergency situation. The ePulse is an amazing project that we came up with to try and rectify the situation.
For EMS, they're very excited because this takes so much of the uncomfortable position, the very tough spot that they get put into, dealing with emotionally charged scenes, family not being able to regurgitate the information that has been discussed by the patient with their family and their doctor of what the patient's wishes are. And of course, when emotions become involved, you lose your memory and you can't remember where anything was put.
The actual pulse itself is kept online in a secure database so that it's always updatable. If the patient changes their minds or wants to amend it at any time, that can easily be done by them going online with their physician, changing the form, and then it's signed by the patient and the physician electronically.
John began to experience substernal pain.
I was on my motorcycle. I started to feel chest pains. I kept on going.
He started to have this pressure in his chest.
Felt like somebody was pushing very, very hard on my chest.
And he knew there was something the matter.
And then I started to sweat, and I'm not really a sweater, but I did sweat. That's a sign, all right.
And the question was, what was he going to do? Every 15 minutes matters.
There was a Walgreens there, and I went in, and I told them that I was having a heart attack. Please call the ambulance.
"911's activated. My people arrived. Firefighters, paramedics. Mr. Dalton was in serious condition.
They got me in and asked me a bunch of questions.
Clicking through their mind is he having a heart attack? My medics are acquiring an electrocardiogram.
They decided to take me to the UCSD.
The medics have a button that says, this is the closest hospital, let's send it to them. An entire team is now descending to the emergency department to help us with this gentleman.
Years ago, they would have had to wait till I got there before they could tell a doctor what they thought was going on.
When he arrives, now we've got to get him upstairs. The ED doc takes one more look, make sure everything's stable, and up you go to the cath lab.
Next thing I knew, my family was there, and they even showed them on the monitor the procedure that they did to me. So it was really nice for them to know that I was okay.
We all have these precious resources that we're trying to use, and we want to allocate them to put the right person at the right time at the right place.
I shouldn't say this, but I feel great. They were just a bunch of people that came to work that day and did what they do, just like any one of us.
And that's what Beacon is all about. It's matching a resource with a need by having information that can actually make a difference.